Did you know that over 1 million people die from mosquito-borne disease every year? We are going to use life science to investigate mosquito-borne disease.
A mosquito is a vector that causes viruses along with many protozoan and filarial diseases. A protozoan is a single-celled microscopic animal of the Protista kingdom that includes amoeba, flagellate, ciliate, and sporozoan organisms. Malaria is a sporozoan disease transmitted by infected mosquitoes. The protozoa travel through a human's blood to the liver, where they multiply. Let's ask my pediatrician, Dr. David Goff, who coincidentally sounds like Sal Khan, what he knows about malaria.
Studies have shown that a child dies every 40 seconds from malaria in our world. That means that 5 children will die in the time it takes somebody to watch your video.
He sounds like Mr. Khan. Weird, right? We need worldwide access to the anti-malarial drugs which have already been developed. West Nile virus is a flavivirus carried by birds, comparable to encephalitis. Imagine if a mosquito named Skeeter fed on the blood of an infected bird named Flappy. Skeeter the vector can now infect mammals, especially humans. Symptoms can seem the same as any common flu virus. The best treatment is to wait for the virus to run its course. Heartworms affect many mammals, but the main concern is for dogs.
Imagine that my neighbor has a heartworm-infected dog named Barkley, and baby worms called microfilaria are circulating through his bloodstream. Then a mosquito named Skeeter flies over and feeds off of Barkley's blood.
Skeeter comes over to my house and then bites my dog, Rosie. The microfilaria can then climb into the wound caused by Skeeter and remain in Rosie's skin for 3 to 4 months. At this point, the microfilaria normally die in humans, but in dogs, they do not. The microfilaria will then remigrate through Rosie's bloodstream and reproduce in her pulmonary arteries and right side of her heart. Heartworm prevention is available in all veterinary clinics and is the only way to protect animals against heartworm infection. The prevention medication absorbs into a dog's skin oils and kills the microfilaria. The Zika virus is a flavivirus similar to West Nile, which has no known cure and may cause symptoms such as fever, rash, conjunctivitis, and joint pain, lasting as little as a few days but up to months. It is normally an uneventful disease, but the real problem lies in microcephaly of the unborn. Zika causes congenital defects of the cranium and brain size, which causes severe neurological irregularities, such as empty spaces in the brain, cataracts, and congenital deafness. So how can we normal people help stop mosquito diseases? It's simple. You can eliminate mosquito habitats in their beginning life cycle stage by dumping out any container with standing water. If anyone spends time outside, they should apply mosquito repellents or wear long sleeve shirts and pants. Alrighty, my time is up. I hope you have learned valuable information about the life science of mosquito contracted diseases, and always watch out for Skeeter the Eater.